I am Dr Mohan Rao, Professor of Medicine and Endocrinologist at Rajarajeshwari Medical College, Bangalore. I will be discussing today in the latest development in the field of diabetes. As we all are aware, diabetes is a disease which affects millions of people of all ages worldwide. India alone has, as per the latest ICMR 2023 survey, 101 million diabetics and 132 million pre-diabetics, which may potentially become diabetics in the future. With this rise prevalence, the recent development in diabetes research have been exciting, with several breakthroughs in understanding the disease pathogenesis, the potential new treatment, as well as in the development of state-of-the-art advanced glucose monitoring systems as well as insulin delivery systems. In our routine clinical practice, we primarily encounter three types of diabetes. Type 1 diabetes, which primarily affect children because of the destruction of the beta cell producing insulin with their own immune system. Secondly, gestational diabetes, which mainly comes during pregnancy and disappears after delivery. The most importantly, the third one, that the type 2 diabetes, is the one which commonly encounter in our clinical practice, affects 9 to 11% of the general population as per the latest survey. The rise in prevalence of type 2 diabetes, which used to be 4 to 6% a couple of decades back, now has become 9 to 11%, almost has doubled. The recent increase in the prevalence is largely due to increase in the prevalence of obesity, which is due to the excessive consumption of refined carbohydrates, fats, lack of physical activity, environmental pollution, stressful lifestyle, as well as chemicals used in the industry as well as in the agricultural and farming sectors, which causes epigenetic changes leading to the increased prevalence of type 2 diabetes mellitus. So, according to the latest one, it is possible to reverse the diabetes process. Actually, the exact term is remission, because diabetes is not a curable disease, but you can put into remission with proper lifestyle modification, that is by reducing the calorie consumption, reducing carbohydrates, reducing fats, increasing the animal, mainly the vegetable protein intake, and increasing the physical activity, as well as reducing the environmental pollution. With all these and reducing the stress level by yoga and meditation, with these things we can it results in a loss of weight of around 5 to 10%. With a loss of 10 to 10% of weight loss, it is possible to put the diabetes into remission. That means diabetes can be brought back to the normal blood sugar values without using any medication for an extended period of time. For people who are unable to reverse the diabetes through diet and lifestyle, now new treatments are available, that is GLP-1, we call it the glucagon-like polypeptide 1, a hormone normally produced in the intestine, which helps in the production of insulin as well as acts on the brain to control our appetite regulation. Now these GLP-1 are available in oral form, once a day injectable form, and once a week injectable form. Of late, from the past decade, the research have shown us that once a week injectable form results in the loss of almost 20% weight loss, with that the reversal of diabetes, and also helps in the reduction of cardiovascular and neurological stroke problems. Additionally, the diabetes research have shown that we have able to produce a advanced state-of-the-art continuous glucose monitoring system, which monitor the blood sugar every 5 minutes, and these blood sugar readings can be connected to the mobile app as well as to the insulin delivery system, that is insulin pump, which senses the glucose values sent by the CGMS and deliver insulin continuously, mimicking the normal functioning of the pancreas. These systems are especially useful in the management of type 1 diabetes. So with this advancement in technological advancement in the understanding the pathogenesis, diagnosis and the new treatment available, it is not only possible to reverse the diabetes, or in case if it is not possible to reverse, at least we can able to control the diabetes better, thereby preventing the long-term complication of diabetes like heart disease, stroke, retinopathy, nephropathy, neuropathy, allowing the individuals to lead a healthier lives.